Hi everyone, I'm Dr. Tony. Today we are talking about fertility, and this is a topic that affects millions of couples worldwide. Infertility is when a couple cannot conceive after 12 months of regular, unprotected intercourse if the woman is under 35 years. And usually we say 6 months of unprotected intercourse if the woman is over 35 years, depending on where you find yourself. And so, um, you cannot tell me that you are infertile or you cannot give birth when you are using a condom, or when you don't have regular sex. Maybe you're having sex once every month. If you come to a doctor and say that you are not able to conceive, they will tell you to go back and try at least maybe 3 times a week, you know. And so all that has to be taken into consideration. So in this video, we'll discuss some of these things. We'll discuss when conception is still possible and the signs to watch out for in both partners, and then the risk factors that affect fertility, how imaging can also help, and then lifestyle steps and modern treatments to improve your chances. Many people think that infertility is just a woman's issue, but in reality, it's an issue for both partners. Both partners play a role when it comes to infertility. So, um, the the man shouldn't just say that um, he's not a part of this. He has to also get checked. Even if you've been trying for a while without success, there is hope. And let's say that conception is, however, more likely if you are under the age of 35 with a regular menstrual cycle, and also if there is no severe fertility issue diagnosed in either of the partner. However, medical evaluation can significantly improve our chances of especially of getting pregnant, especially for older couples or when there are some known challenges. You know, so what do we watch out for both partners? So for women, we have to look at our period. We have to look and see, is a period irregular, or we are not having a period at all. And this may indicate some ovulatory problems or hormonal imbalances. So some labs will probably have to be done. We also look at signs such as painful periods or pelvic pain, and this could suggest things such as maybe a fibroid, endometriosis, or past infection. In fact, well, a lot of people with fibroids still get pregnant. However, there may be instances, depending on the location of the fibroid, where it could affect your fertility. So that's why I put in fibroids. And then the history of pelvic infection or surgeries should also be a sign. And this could lead to recurrent infections, could lead to scarring or blockage of maybe the tube or even the uterine walls, and this could affect fertility. For men, on the other hand, low sperm volume or poor sperm quality is a contributory factor, and this reduces chances of fertilizing an egg. And then we could also have testicular injuries, surgeries, or infections, and this could affect, the production of sperm or the sperm flow. And then we could have hormonal issues or chronic illness, and these conditions, uh, we have conditions like maybe low testosterone. People with obesity or maybe diabetes could reduce like the quality of the sperm and stuff like that. So what do we have to consider? We have to look at our timing matters. Fertility is highest during your ovulatory window, and that's a few days before and on the day of ovulation. That's when you should take the chance. So if your husband is sleeping, wake him up, and then do let him do what he's supposed to do. And also, regular intercourse during this time improves the chances of conception. So let's look at some other risk factors for infertility. So for the women, we may have hormonal imbalance causing the ovulatory problems such as um, polycystic ovarian syndrome. We could also have a blocked fallopian tube, which I mentioned earlier on, from infection, surgeries, or endometriosis, and we could have uterine abnormalities like fibroids or polyps. And for the men, we've mentioned a couple, including the low sperm counts, etc. And then sometimes you may have the sperm ducts being blocked also. And then the shared factors between the women and the men are that of the age-related decline. So women after the age of 35, usually the chances become a little bit low, and then men usually after the age of 40. Usually with the men, it's not so much of a problem, but it still happens. And then we have to look at our lifestyle also. Lifestyle is very important in a lot of things. So um, we have to look at, if we smoke, we have to try as much as possible to reduce that, because it can also affect the sperms. And alcohol and stress should also be taken care of. So try as much as possible not to stress each other. Sometimes the mere fact that you are infertile in the first place stresses you out, and you have to make a conscious effort not to get stressed. For women to stress can sometimes cause hormonal imbalances, and then your ovulation goes haywire. So it's important that you reduce stress to its minimum. Let's look at where I come in. So the imaging aspect of infertility. We have what we call follicular tracking, and this is a type of ultrasound that we do. And here we try to monitor the ovaries and the follicles within the ovary for proper egg development. So we look at the sizes of the ovary, and this is not just a trans-abdominal ultrasound. Most of the time it's done transvaginally, because um, transvaginally the ovary becomes is seen as a bigger structure, and we can see the details, a little bit of the details within the ovary. And this helps us to determine ovulation timing for natural or assisted conception. So when we see that, okay, the follicles are a certain size and a certain texture in nature, then we inform um, the gynecologist, and they can do certain procedures to help improve your chances. We also have what we call the hysterosalpingogram, which is what people popularly call HSG. And this is a type of X-ray that is done under what we call fluoroscopic guidance. And here we would inject a dye through your cervix into your womb to see whether the tubes are patent, and to be sure that there are no structural defects in the womb. Okay, so we do that sometimes on a regular basis, not for just one patient. I mean, for um, patients who have infertility, and we are trying to find the cause of infertility. We want to be sure that the tubes are patent, so that the egg can be transferred from the ovary into the womb for implantation to take place, and also for the sperm to meet with the egg. And we can also do a simple pelvic ultrasound, just to evaluate the uterus and your ovaries, and also to check to see if there are any suspicious cysts or fibroids, or sometimes endometriosis. And we may also do an ultrasound of the testes for the men. Okay, and this would help us detect subtle things like a varicocele. Varicoceles can also reduce the chances of a man getting. It may also reduce the chances of pregnancy. And these are just dilated and let me see, wound up veins, within the scrotum. And We also look for cysts and other structural issues which could affect, the testes and the sperms. And sometimes we do advanced imaging, which um, is done occasionally for complex uterine or pelvic abnormalities. So for issues that just the ultrasound cannot pick up, we can do an MRI scan. So imaging allows the doctor to identify the exact risk factors affecting fertility and to tailor treatment accordingly. So what should we do as couples? I mean, what should a couple do? Let's look at lifestyle. Let's be practical here. So, maintaining good health and weight for hormone balance, tracking our cycle and ovulation, reducing stress, and avoiding smoking, excessive alcohol, and certain medications. And for men, also, we need to reduce, um, maintain a healthy weight, avoid excessive heat. That's important. Avoid heat. A lot of the times we see some men putting laptops on their lap, and you know that that's where um, the future children are. So you don't want um, to to increase the heat over there. There's a reason the scrotum is not inside the body, but it's hanging outside the body. And so try to avoid putting laptops on your lap. Exercise moderately and then limit smoking, alcohol, and recreational drug use. And for both partners, eat a balanced, nutritious, rich diet. And then time your intercourse during the fertile window. If you can have a timetable or a chart or something, people have apps that they are able to time their intercourse, are able to time their ovulation, and seek medical evaluation if conception does not occur after 12 months or 6 months if you are over 35 years of age. Let's look at the medical advances that makes it possible for many couples to now conceive, even though it was difficult in the past. So we have medications that we can give, and some of these medications will stimulate the production of sperm. Some also helps to stimulate um, the eggs. And then we also have intrauterine insemination, where the sperm is placed directly into the uterus to improve the chances. Maybe the sperm cannot swim, so we'll help it by putting it directly in there. And then we also have in vitro fertilization, where um, the eggs fertilized outside the body and are fertilized outside the body, and then they are then implanted into the uterus. And this is useful when the tubes are blocked or the sperm quality is low. And we have surgical interventions such as correctional surgery, such as to correct structural issues such as blocked tubes or varicocele, like we take out the varicocele, or treatment of fibroids that may be blocking the pathway of or preventing implantation. So all these can be done under surgical interventions. And then the complementary approaches are the lifestyle changes, which includes our nutrition, stress reduction, and weight management. I've stressed on this so many times because I want us to make sure that we don't stress ourselves. Okay, so even if conception hasn't happened yet, let's know that there is still hope. All is not lost. Okay, early evaluation and proper testing, imaging, and modern treatments means most couples can eventually conceive. And infertility is rarely one-sided, so addressing both partners gives us the best chance of success. So make sure that you see your gynecologist if you feel that you um, are not able to conceive within the stipulated period that I have mentioned. Watch out for warning signs in both partners. Know your risk factors and manage what you can. and use imaging and evaluation early. Maintain a healthy lifestyle. Explore modern fertility treatments if needed. I am Dr. Tony. Take care of your fertility, support each other, and remember that early evaluation and proper guidance makes all the difference. So if this video has helped you or it helps you, like, share, and subscribe for more easy to understand health explanations. Thank you very much and have a good day.